we record that and it sits in the patient's profile. Then we also record the label language, because this is very much useful for every time. We don't have to ask them whether you need a label in English or Marathi or Telugu or Tamil, whatever it is. So, and also we record the diagnosis part. So if this diagnosis is it's through prescription, we record that diagnosis there. And if it's through we identifying it's a common cold or diarrhea, that is stored here. And then we update it, and that stays in the patient's profile. So let's look at the dispensing process of the medication. So in this case, what happens is once the patient is registered, I've just used my name for the example purposes, we can search the medication using brand name or else the generic name, which is amlodipine. And then there is an option for prescription upload. Why we have kept this option? So this, in this case, say tomorrow if a DI comes for auditing to the pharmacy, saying that have you given a sleeping medication for someone else? So what we do is, in that case, we upload the prescription when we are dispensing the medicine, and it sits in the patient's dispensing history. So that's really helpful so that we are following the law as per regulations, and any H1 or benzodiazepines, we do this process. And here you can see this lot of important icons here, which I'll be discussing in the next coming slides. And in the dispensing, we type in the admin instructions like take, administer, or spray, or like, apply, and then dose, how much, like 1 tablet. Dosage form comes from the back end when the tablet is actually added to the system. And the route of administration, there are various routes of administration, from oral to IV to IM to SC and everything. And the frequency, like when to give, how many times a day, and there's extra information. So the extra information is actually has a data where you can type in the information, or else there are predefined data sets as well. So where you put in the code and it comes up with what is required, so that the typing work will be reduced. So that is helpful. And then we generate it and then we save it. So that's the way we put through the dispensing of the medication in our software. So let's look at what we do in terms of patient counseling. As I said, there are a couple of icons here. So first one being the special directions. So in this case, when you type in or select the medication, when you get the click on that icon, the special directions icon, it shows up the patient counseling points. So this is very helpful for the pharmacist when they are doing it for the first time, or else like even young graduates. So when they use it, so they can go through that information, and then they can talk to the customer or the patient about what they are supposed to be doing when they're taking these medicines. That's the patient counseling part. And next, we have the dispensing consultation while dispensing. So the second icon. So what happens with dispensing consultation is here, for every medicine, we actually talk about what they are, as a pharmacist, what we should be aware while giving this medicine, especially in terms of pathophysiology, drug interactions, or else if it's anything related that the patient is experiencing a side effect, that data like contraindication or common side effects may be available here. And even if there is any, like if you see the increase of serum transaminases, so if you look at the lab profile in the if the patient has a lab profile, oh yes, this medication may be one of the reasons. So that is helpful for the pharmacist in general. So the next one slide is regarding the dose check while dispensing. So if you see the medicine, and this icon is for dose check. So you have a prescription, you can cross-check the dose of the medication, whether the doctor has written the correct medication, or else even if you're doing an OTC dispensing, you can check if the what dose has to be given for the customer or the patient. So that's really helpful. So it contains every different dose of different conditions and how many days it needs to be given and that sort of thing. So you can cross verify any prescription with that. So that actually helps in the one of the 5 R's, which is the right dose confirmation for the patient. So next we look at drug interactions while dispensing. So any drug, when you choose them, then this icon, when you click on that, the drug interaction icon, it comes up with major or very serious drug interactions are actually explained for that drug. So if the patient is taking any other, like penicillin, in this case of doxycycline, may interfere with the bactericidal action of penicillin and that sort of information. So this is really useful for the pharmacist while dispensing, so that he can go through the other medicines which he is taking, especially with chronic meds, and they can look after the look to the drug if there's any interaction with any other medications. So yeah, if we have a female patient who is in the pregnancy status, like it could be childbearing age, this is very helpful. So we can do a check if the drug is suitable in pregnancy or not. So in case of doxycycline, it's like can be used for 8 weeks. So for each drug, we have a pregnancy safety check, and same goes with even the breastfeeding information. So whether it can be used safely in breastfeeding or not. So that's about the software, and we have this is the multilingual personalized dispensing labeling. This is actually what you see on the screen. Here it is basically what realistically it appears on in the pharmacy when you print it up. So why are we using multilingual dispensing? So in India is a big country, and a lot of people do know English, but there are a lot of people who are very comfortable with their own mother tongue as well. So we have installed the multilingual software in this, so that it can be printed in any language, major language across the world. It's not just India, it is across the world. So why it's very useful? So people can understand the medications in their own language, and people have a very busy schedule, like young working professionals, or even old people, or even a parent who is concerned about their children. So this label actually helps them to understand the exact dose what they need to give, because it's personalized for that specific person. And it also tells them other information like batch number, expiry, and the price of how many tablets they have bought, and even the brand names and the generic names of the medication. And it also tells the pharmacist what cautionary label they need to stick on when they are dispensing this medicine. So it's very useful, even in case of people who come from abroad. Like I have people who come from Japan and Sweden and any other country, and even Germany. I've printed labels in their language so that it's easy for the border control officials to understand. Yes, it's a prescription medicine this gentleman is taking, or the lady is taking. So we have this, we also stick on, as I said, when you have the dispensing, we have these labels for 3B, 3D, and you can see 3A here. So these are cautionary labels, which is very predominantly used in the US and other many developed countries. So that actually helps to for the customer or patient to understand that this is a possible side effect when they take this medication. So like, for example, if they're on any benzos or any high drowsy antihistamine, the label number 1 goes or 12 goes on, and we can inform that this medicine may cause drowsiness, and they should be aware about it. And if they're going to drive, be very careful about it. And also there are cautionary labels, say like in this case, if you see swallow whole, do not crush or chew, especially drugs which have a long acting or a slow release medication. They're not supposed to cut or chew the medications. So that cautionary label can be used. And like these ones, like special handling, like methotrexate or any cancer drug, or if there's like, for example, in case of 3A or 3B, we use it in flucloxacillin, which actually requires an empty stomach for good absorption rather than taking after food, which affects the absorption. So that's really useful for the customers. So we also maintain a dispensing history of the customer. As we dispense every day, it actually goes into the dispensing history of the customer. So this is really helpful when we know that this patient is on these medicines when they're regular customers for us. And also when they come back even after 1 year or 2 years, yes, sir, you gave me that medicine and it really worked well. So I can just go on the specific date and identify that, and we can give that medication back to him if they have a proper prescription. Okay. So that's a dispensing history. Yeah, so as I said about the medication profile creation. So in this case, we actually can create a medication profile. So this is given even in soft copy as well as in hard copy. This is very useful for the patient, because when they are going to a hospital in an emergency situation, either if they have a soft copy or hard copy, they can really go and show it to the doctor, and they can see if their patient is allergic to any medicines, are they on these medicines, these are need to be stopped, these are need to be continued, and that's actually recorded in their episode of case admission in the hospital as well. And this is also multilingual, so this can be printed in any language you prefer or the patient prefers. So yeah, so that was about software. So we did conduct a survey actually with our customers about the services we give in terms of labeling, medication profile, all the aspects of labeling, cautionary labels. Just going through that survey results from our customers. As of now, it's we have about 117 responses, which is just not 117. It's actually the head of the family representing each 3 or 4 members of the family. So nearly about 300 to 400 reviews, and you can see that the results are what we have got from the survey. So what we are talking here is actually, does the medicine composition that appears in the dispensing label helps you? Well, 98% of the people say yes, it really helps them to understand what brands they can use with that specific generic name. So we have other things like, there's an instruction on label usage, how to use the medicines. Even though they have a prescription in their hand, with sometimes the handwriting is not legible, patients feel really hard to understand what the doctor has written. So this label with the instruction of usage really helps them, and like how to take it, how much they should not exceed, and that sort of information. So you can see it's 100% yes to that. And so another question we asked is, does the mentioning of expiry date on dispensing label of a custard strip? So in India, not like other nations like US or Australia or any European countries where we give the whole box as such, but a whole strip as such. But here we need to cut the medicines because of economic issues and other aspects as well. So here we actually mention the batch number and expiry. That actually helps the customer to understand that yes, this is going to expire on so date, and also why the batch number. If there's a recall from the government, you may recall there was a recall of ranitidine recently because they had an NDMA into it, which is actually carcinogenic. So that's sort of where we can trace it back to the customer in our reports, call them back saying that please don't use the medication because there's a recall from the government or the manufacturer. Then do you think the instructions given the color-coded cautionary labels? It's 100%. Everyone likes it. They love it because it helps them to identify the side effects and in terms of increasing the medicine efficiency and all other aspects of taking the medication. So this is one important aspect. Do you think medication counseling from a pharmacist helps you to get a better understanding? It's 99% they say yes, we need a medication counseling, which is very much absent in our society or Indian pharmacy practice as of now. So for this, as I said before, we have that in the software, the patient counseling part, which is really good. The pharmacists can go through that and counsel their customers about that, and they find it really useful. And say we asked whether it's good to print the labels in regional languages, and yes, they love it, and 99% of them love it because it's very useful for them, for people who don't understand English as such, because it's not their mother tongue, and they're comfortable with their own language. And this is another important question we asked them: would you recommend or refer to anyone about this type of pharmacy practice? Many of them say yes, because they love the way it's practiced, and they didn't find anyone who practices in this way. And this is the very much important question which everyone would love to see in this presentation. Would you prefer such pharmacies all over India? Very much. They love it. They would like to have this sort of pharmacy services across India, so that everyone feels safe about their medication. Everyone feels that yes, we are in secure hands. And no, we are not popping up pills leading to hospitalization or any morbidity increase. And just to let you know about how often they like to visit our pharmacy, most of them like whenever they wanted medicine. And someone said like only if anyone's sick, which is fair enough. If people are sick, then they come to pharmacy. And very little of them say only when their own local pharmacy is closed, they come to our pharmacy. So it was an impressive result, and so now we are looking how we Medox and ACPI members can collaborate with each other. Sorry. So what we were thinking, myself and Sri, was that model pharmacies in pharmacy colleges. That's a new concept. Well, it's it's maybe in abroad it's there, like in Australia we don't find it, but maybe in US we do have model pharmacy. Dr. Bhatt may be able to answer that well. So in India, when you see medical colleges do have teaching hospitals, and many of us know about that. So why not pharmacy college have a pharmacy open to public? Well, that's what we think about, in such a way that this type of pharmacy practice actually, when you implement it, it helps the professors and lecturers to train the students early on in their graduation program, right, like second year or so, and students will develop an interest in the clinical retail pharmacy practice and entrepreneurship as well. So, I mean, to be honest, when I was did my B Pharm from India, we don't have any exposure to how really the pharmacy works outside. Even when you go out, it's the non-professionals who are working there, and that's not the real pharmacy practice. So when we have this sort of curriculum or real practical training in the colleges, when they have their own model pharmacy, that will really help the students appreciate the pharmacy practice, and even they may love to become entrepreneurs. And that way we can get India to have new sort of pharmacists who want to open this sort of pharmacy, and we can get rid of non-professionals working in that field. Apart from colleges, if any of the ACPI members, or even if in contact or acquaintance or friends of ACPI members who run pharmacies across India, run by pharmacists, but if they start taking up this sort of professional practice, and they will change the way pharmacy is practiced in India. So in general, what I can say is the above practices will actually change the way pharmacy is looked at in India. They will have this will increase the respect of the profession in the society, and we can have more professionally run pharmacies across the nation. And Medox Pharmacy is always here to help. We are very much happy to collaborate with ACPI and other members towards this paradigm shift in the practice of pharmacy in India. That's it from my side. Any questions from any of the audiences, please?
Hello.
Yeah.
Yeah. First of all, I would like to congratulate Mr. Tilak and Sridevi ma'am that I really appreciate your passion to continue the same practices what you were following in Australia, coming in India, establishing and making people comfortable about it. Only one thing the counseling points and whatever you have taken regarding drug interactions, counseling point and pregnancy data, is it been abstracted from any of the website, or you have added that into the software?
Yeah, all this data, which the clinical data we have, is from all the reference journals. Like in Australia, we use Australian Pharmaceutical Formulary, and then we have MIMS in India and Asia Pacific, and we have Medscape and many other reference sites, which is very, very well regulated.
No, but here it is fed in your software, or it has been abstracted from some other website. It is linked to something.
No. It is fed in the software. We don't link it to anything.
So it is not linked, right?
No, it's not linked.
So it is something what you have added into it.
Yeah, it's all added up into that.
Okay.
But if you're going to be linked it, like, it will take some time, because it goes to the other browser, it opens up, then you have to log in, and
not for anything, like, as we are planning to introduce, maybe there is no doubt, like, regarding your expertise in this field. But at many cases, whenever the regulators come, they want the authenticity of the data. So that's the reason I asked you that what is the source of the information?
Yes, so that's right. We will put it in the disclaimer, ma'am, saying that these are the sources which the clinical information has been procured from, and that's useful.
No, it is a very good practice, actually, much needed practice.
Yes, ma'am.
Because the patient education is something what is lacking highly in India.
Yes, thank you. Just to add to that, it's just that this entire software works as a guiding tool. Basically, it talks about what a person, even though a fresher, needs to know in case he needs to dispense the medicines. So a fresh pharmacist can, using this tool, he can dispense the medicines talk about. See, we don't explain in detail about the medicines. We just take on talk about the very salient features, what the person or the patient or the customer or the consumer needs to know about this medicine. So just very important points that are explained by the pharmacist in order to help them to be confident to know what they can expect from that medicine. So those important points are mentioned in the software. So yeah.
I can add a point on this, ma'am. Actually, like Australia, there was a research on the labeling aspect and the cautionary labels in a different color coding. So what they said is actually this is very much useful because people don't want to go through stories about each medicine. Like if you go to 1mg or even like here in MedPlus or Apollo, any website, they have all the data given for each for everything. You should not drink alcohol. You should not. It is not safe for pregnancy. Why? So, but nobody is like as a customer, you or me or anyone else, nobody will have a patience to go through the whole medication profile saying that okay, this is what I did not do. But of course, yeah, they do if they're very they're taking care of their own health. But if someone else is looking for them, the patient's level comes down. But if you have this specific information which you need to pass it on to the customer, and very specific color coded ancillary labels or labels which actually tells you the exact thing about what is very specific about this medication in terms of caution, that helps because it sits in their mind.
Yes, that is required. That's what I'm saying. This is the most required area wherein we have to put our head, we have to make safe dispensing and users practices. That is there. But only what happens is I was concerned about no one should object on the data what we are giving. So I asked you whether you are abstracting it from any of the official websites.
Correct. Yeah.
And secondly, I wanted to ask you the labels whatever you are making, right? Are you adhering it to the container itself?
No, ma'am. No.
No.
We actually put it in the covers.
Covers, right?
Yeah.
Because whenever we label, attaching that onto the bottle again can create some of the.
Correct. It's not legal because
It's not legal. That's the reason.
It can
I
cause
wanted
problem
to ask
because we
you.
are masking some information on it.
Yes. No, first time I have seen the personalized label. Remaining everything at least I'm aware of. But the personalized labels, how you have shown, I have seen for the first time. So that was just my curiosity, that how you dispense it, whether on the container for that fellow or it is separate.
Yeah, so we have paper bags, which we kind of slide in the medicine, the blister packs inside, and we'll stick it on the paper bags before we hand it out. So the ancillary labels are also stuck on the same paper bags because the minute the person takes the paper bag, before he takes the medicine out, he has got enough information about the medicine. It appears right there. And along with the cautionary labels, which are stuck right next to the label, it helps him to identify and know what caution he needs to take about that particular medicine, the respective medicine he's going to take. Yeah.
And what about adherence to the therapy? Have you added something about that also in the software?
As in
refills and all. Yeah.
Sorry.
Refills.
Yeah, Miss, nowadays what is happening? Adherence to the therapy also is a problem, no? Miss, whenever they are supposed to take, whether they are taking, not taking. Because what happened here, people don't go to the same pharmacy, right? Today they are taking from you, tomorrow they will take from someone else. So whether they are consuming the required dose for, especially for the chronic conditions and all. So have you added something onto that?
We have not added anything with regard to the adherence though, but I think your question is, are they coming back to us? Am I getting it right, ma'am? Are they coming back to us regarding or adhering to the pharmacy? Or is it adhering to the medicine?
One of the ignored area here, what we are facing problem, okay, is the patients are not adhering to the therapy. So that patient adherence if we want to evaluate, okay. So in that case, the same thing may be as we cannot force them, but are they coming back to you?
Yes.
Are you keeping a track that whether they are taking monthly dosage from you? and they're coming at the end of the month, something like that?
Well, ma'am, we do have a dispensing history, like we mentioned. So we tend to get an idea from the dispensing history when the patient has last visited us. So let's say in case of a chronic medicine, an antihypertensive medicine has been handed out to a patient. So we would obviously expect him within a period of, let's say, very close to another month, he would be visiting us. To be very honest, we haven't taken any specific steps towards understanding the compliance of the patient. But to put it in a nutshell, superficially, what we have noticed is the patients are more than happy to visit us again and again, because they have developed a trust and they have developed a confidence with respect to the medicines with us. And so that trust and confidence have brought them back. So they're happy to come back to us. They're happy to visit us. And the service that we have offered them have always brought them back to us. So yes, but we haven't taken any specific study to understand whether the patient has been always adhering to the pharmacy or adhering to the medicine.
Yeah, adding to that point, ma'am, we actually have a cautionary label saying that do not stop this medication until the doctor advises so. It's called label number 9, which we use it for chronic meds like BP and diabetic medicines. And apart from that, for example, in the case of antibiotics, we put it in the label saying that course should be completed until all taken. So that data goes through inside.
No, very nice.
Yeah.
If you added all the information, it's really great that I can imagine how much time you must have invested in developing the software. Really nice.
Yes, ma'am.
Yes. So there are people who have come to us. There are people who have mentioned this to us, that they never knew that the antibiotics, that certain antibiotics, the dry powder, which has to be mixed up, the constitution has to be made and have to be refrigerated. So this information was never known to the customers or the patient's parents, like children's child parents.
They used to keep the antibiotic syrups which are mixed with water outside, not in the fridge outside, and used to get spoiled.
So there are stickers that these cautionary labels also mention that please refrigerate, shake the bottle well before use, or discard.
Can I come in now?
Yes.
May I come in now?
Sure, sir.
Thank you very much. This is Professor Bijon Kumar Mishra. Namaskar to everybody and Happy New Year to all. Firstly, let me congratulate Medox founders. I mean, it's absolutely a marvelous kind of a tool created, and your presentation was actually music in my ears, who works in the interest of patients in the country. So, we have been working very hard to understand how to bring about good pharmacy practices in the country to ensure the patients are well protected and they're taken care in terms of their safety and also efficacy of the medicine which they purchase out of their hard-earned scarce money. As you know, healthcare is becoming very, very, very expensive in our country. So we are fighting against the inflationary trend of healthcare, and medicine contributes a lot in terms of the cost of healthcare in our country. So having said that, I have 2-3 questions to ask you. First is what Dr. Shilpa said. I think it's a great input for you all to add in the software in terms of compliance by the patient, which is very important. I think she has raised a very, very valid point where patients' compliance should also get recorded whenever they come back to you, or from wherever they come back to you from any other pharmacy. It will be a good addition to your excellent software which you have created. So I am always a believer of taking inputs as a suggestion, not as a criticism. So we don't need to defend ourselves. We need to improve our software in a dynamic manner. So we need to improve this software which you have created. So my next question is, have you made this presentation to any government agencies?
No, sir.
Okay. So the first thing is, I would recommend to you as you are based out of Hyderabad, I am based out of Hyderabad.
Oh,
Let us try to take it to the Telangana government. Let us try to take it to the Andhra Pradesh government. Let us take it to the central government to share this discovery which you have done in terms of the software. If we can share it with the pharmacies of the country, subsidized by the government or supported by the government. So let us try to, expand the software. Unless you want to have a proprietary right or you don't want to share, I would suggest that you can fix a price to your software and lend it to people to encourage knowledge to be spread. So as you have not approached the government, I would like to help you in doing that. That's number two. Number three, have you linked pharmacovigilance with this software? Because I didn't see anywhere you have mentioned about it. So if anybody comes with an adverse drug reaction, are you reporting it or not in the pharmacovigilance program of India?
I just wanted to answer that, sir. Actually, we our PVPI WhatsApp group is there, but I came to know that they don't allow community pharmacy to report it, sir. It's mainly in the hospitals that are allowed to do that.
No, I don't agree with you there because
Okay, no, I was actually informed about it, sir. That's
no, they have given you wrong information. Let me give you the right information.
Okay.
We have developed feedback mechanism for PVVI program where any professionals, including consumers, can report.
Right.
So if you go to their website, there's a feedback form. Please download that feedback form, which we had developed in many languages, like you are doing in many languages. I congratulate you again for developing the software which can be connected with many patients or consumers with different lingual background. So it's a very good initiative which you have taken. I think you should get connected with PVPI also.
Okay.
The last point I want to share with you is that in your recommendation, you mentioned about pharmacy colleges.
Right.
Please start with connecting with all the Jan Aushadhi stores in the country. There are about 13,000 plus, almost 14,000 Jan Aushadhi stores in the country, which are dispensing, generic medicines at a very affordable cost. And it's a very successful program. We want to make it further strong and accessible in order to bring in fair competition, fair, kind of dispensing good practices of medicines in the country. So I would recommend that you should recommend to the government to give your software or your expertise or your knowledge to all the Jan Aushadhi stores to come into this framework of good pharmacy practices. Because we are actually looking at this challenge which is there. Because in India, as you know, we have a law, but we don't have a monitoring mechanism in terms of implementation of the law in a standardized manner. But your tool is going to work towards that in developing a mechanism which will be more than the law. So I am looking at why not, our association collaborates with you to develop a mechanism which is more than the law and give some kind of a logo to those pharmacies who are agreeing to practice those good practices which you are recommending through your tool, which is comprehensive and also enabling, the pharmacists to follow the law and document, so that tomorrow if there are any kind of a investigation or any kind of a audit, they come out clean and they are able to come out smiling and with comfort. So we want to make the process more transparent and also accountable. So I think great work, and let's stay in touch. I have already taken down your address and website. How many outlets you have got as of today?
Only one, sir.
I want to see thousands of such outlets in the country. Why don't you start franchising and developing outlets which are equivalent to what you are practicing, to ensure that the consumers all over the country are able to access such good pharmacies which are practicing great practices in the country. So congratulations. Thank you very much.
Thank you,
Yes,
sir.
thank you.
Thank you very much. Thanks a lot.
Hello, Mr. Karat, sir.
Namaste. Can I come
Yeah.
in?
Hello, sir. I have few questions regarding the software.
Uh-huh.
Yeah,
Hello.
like Dr. Yeah, is it audible?
Yes, it is. Yeah.
Yes, sir. Thank you so much for inviting me, President Ananta, sir. And we are pretty much already connected before, me and Tilak, sir. And today I can actually able to see what is going on within the software. So I have concern like Dr. Shilpa in the pharmacy, patient counseling area. So are these counseling points or written by a practicing clinical pharmacist or a physician?
No, it's actually counseling points which we written by not I actually loaded into the system, but I gathered it from different different regulatory bodies and like Australian Pharmaceutical Formulary, MIMS Asia Pacific, and also in from APF, Australian Pharmaceutical Formulary, and all this Medscape, and many different sources.
Okay.
Which are very authentic
Okay,
and
so-
very regularized. Yeah.
Yeah. On the screenshot, I can see the counseling points of atorvastatin, and
Yeah.
when I go through it were 3 points, and there are a lot of points which are very mandatory. And regarding the drug, it was mentioned as how many times you want, you can take all day long. But in practical way, it doesn't work like that, no?
All day long, as in
With atorvastatin, we
Needs
normally
to
take it once
be
daily.
include action. No, it's not like once daily. I can see like thrice daily based on dosage adjustment, on a less dose, on more frequencies. But when it comes to drug interaction, you said you're linked with Medscape, no? So it is directly whatever the interactions are updated on the Medscape, will it automatically reflect on Medox?
No. We actually put that data in the software.
Okay, so
What is, I
there
mean,
are
like,
also a lot
see,
of
if you have like in Medscape or any other whatever is very serious, very contraindicated, that's the most important thing. Minor drug interactions can be added, but if the pharmacist would not be have time to go through the whole list when they're dispensing medications.
yeah.
So only
We
serious
are
stuff,
starting.
serious reactions.
Yeah. So when I was working in a neurology department as an intern, and what the neurologists say is, I am giving a counseling to the patient based on his experience, because theory is always a theory. When it comes to practice, he precisely knows what drug works at what condition and to what type of patients. So what he said is, just be with me, note down all the counseling points I'm consistently telling. For this particular disease, this set of counseling only works. Whatever you see on the internet, that's completely theoretical. So that's why what he told, give the counseling in my room itself. Don't go out and give your own counseling. Patient will get definitely confused. So what I'm telling is all the counseling points are verified by our Indian doctors to make sure it fits for the Indian community.
To answer that question, I think it depends on the doctor. The doctor's call. It is very subjective. Certain times, the doctors, let's say in India, or depending upon the severity of the condition, the doses may differ. So the doctor may consider to add on the dose or to reduce the number of dosing times in certain cases. This is not always the same, but it may happen. So we are not trying to individualize for each and every single patient, but this is pretty much a superficial information which we have gathered and we have uploaded in the software to give us a bigger picture when it comes to any sort of a medicine. So let us say this particular doctor, the neurologist, would like to have his patients take a certain medicine in a particular way. It may be, yes, depending upon his personalized perception, he might have gone that way to dose that patient. In certain situations, we can stick on with the dose. In certain situations, we can speak to the doctor about it. But then again, it becomes a very tedious process. This particular information is uploaded there only to give us an understanding, an idea for the pharmacist who's dealing to know what could be the dose of that particular medicine, what could be the possible condition, what could be the possible dose for that particular condition. Yeah, so it again depends on individuals, and it again depends on the doctors. I think I have answered your question.
Yeah. So how many revisions, frequency of revisions you do for drug interactions or any other counseling points that are coming out from the research or from guidelines per year?
Per year.
But I mean, we have not worked on that as of now. So because like it's a standard guidelines in terms of if it's a molecule which has been there for like quite a long time in the market, like a atorvastatin or doxycycline, the changes in counseling points would not be there most probably. And if there is any new guidelines in terms of the treatment strategy followed by the doctors, even then the dosage may differ, but I need to work on it quite often. Yeah. And
So do
also,
you
answering your questions, so what Divya I would say is clinical expertise is different. So this, I would put a disclaimer on all of these data that it's actually only as a reference point for the pharmacist. So if you find something which is very alarming, yes, they can actually go and speak to the doctor that is going through the data which I have in the software, which is from reference journals. The dose you have given is way too different from that. So if there is any justification, yes, I can understand. But if it's not, please consider changing the dose.
Yeah, okay, because the mostly the public, maybe from rural areas, they don't find a greater difference. Like whoever is giving the counseling, they still they think the person is very authentic, and whatever they're trying to say, sometimes the patient used to forget what the doctor says, and when they come to the pharmacy in urge, they like remember all the points like in short, okay, quick, these are the points I have to take while taking this medication, and everything is documented. So as you told, you're giving a trust more than a service. So at that point of line, we have to make sure we're not compromising on the quality, on the information, especially. Also for
Of
the
course,
pharmacist.
absolutely. Yeah, because
Yeah.
we had cases in our own pharmacy for the past 5 years. I've seen there was one doctor who wrote cilnidipine 3 times a day, and
Okay.
patient literally had so much of peripheral edema and sort of a lot of side effects. And there were another cases where there was cases where you had triple whammy. The doctor wrote an NSAID, ACE, and a diuretic together. Well, he said, "How are you questioning the doctor?" I said, "This is not right, because if you're going to use it, it can cause acute renal failure." And the patient ended up in acute renal failure and reason. And then he came back to me, "Yes, you told me right, I didn't follow. Now I'm suffering."
Okay.
And now
Yeah.
he comes back every time. He's actually not even in Hyderabad. He's from some town outside. He comes here. I come here to my son works in software here. I come here. I check everything before, even if a doctor prescribes, they check with us. Is it correct or is it right? Can I use it? And that sort of thing. Yeah.
Okay, I have another point. I suddenly got to remember that once you told me that this software is purely, like not purely, at least 90% of pharmacy graduates can easily grasp it when it is fused with the counseling points. I still remember you told me. So that's being said, from year 2 to year 6, we are fully packed with counseling points. So while seeing on the screen that only like very limited points are there, does it put down the knowledge updation that a counselor has to gain throughout their career? Like if I'm working in the pharmacy for next 2 years, I should upgrade, not downgrade, no, with the counseling points and other things.
So this is actually
Is there any?
counseling points actually, if you have a molecule in the market for a long time, the counseling point itself doesn't change too much, and you need to tell only salient counseling points to the customers. They won't be waiting there for like 10 minutes just to listen to one drug's counseling points. So we need to specify very whatever is very much required for that medication. So if the case of atorvastatin, we are what the main counseling point as a pharmacist is rhabdomyolysis. So do you have any issue with your muscle pain? That's what I asked. If you have any muscle pain, please report it to your doctor. That's one of the counseling points which we need to specify.
What about liver disease? What about liver disease? What about grapefruit that need to be avoided during
yeah, that
statin?
is there in the cautionary label, Divya.
Okay.
We put a cautionary label saying that don't take grapefruit juice or too much grapefruit juice while taking this. Cautionary label 18, we put that.
Okay. So that will be put in a separate cover, as you told, right? With the tablet.
Yes, yeah. So counseling is separate, cautionary labels is also there. Apart from that, the dosage is clearly explained.
To add a point, we do not want the patients or the consumers or the customers who walk into the pharmacy to be overwhelmed with information about the product that they wanted to consume. So we try to make it very simple. We try not to alarm the person who is going to consume the medicine. And at the same time, we also make sure that he has got the right information and what he can expect out of that medicine. One or two important salient features which is to be explained or which the patient may experience in a 2 weeks time or maybe within a month's time, or you just tell him, okay, the antidepressants are going to take maybe a few weeks, maybe let's say 3 to 4 weeks to kick in. The patient should get that information, that piece of information, because he needs to know how long this may take. So these are the very important salient features that we need to put in and not bombard him with lots of details. I do agree, and the PharmD graduates did learn all these counseling points, but it doesn't mean that we need to talk about it or we need to explain all these points to the consumer or to the patient or the customer who walks in. So yeah, I think that way you're covering the important points, and at the same time you're gaining the trust of the consumer also, because he is not alarmed and he doesn't want he's afraid of coming back to you because you've given him information which he may think, okay, he's telling too much information, he's saying I may get that, I may get this as side effects. So you don't want to
should I use the medicine or not? That thinking should not come in.
Yes, so we need to keep it simple. Yes.
Yes, I do agree. Even many doctors will definitely told us, like, as you guys are study a lot, don't tell everything whatever you study. The patient will get afraid of it, and they never come back. I agree. But for our upgradation or something, for that point of view, I was just curious to know whether this is sufficient, or even if possible, you can link some references. For any serious, are you including any chemo drugs? It's not available in general pharmacy, right?
Chemo, we have chemo drugs. We have information on.
Yeah, I mean, see, the software is designed in such a way that it can be used in hospitals, it can be used in community pharmacy, anywhere. We can inculcate any drug into it.
So it is about adding the medicine and adding the information about the medicine.
Yeah, clinical information about the medicine, and the data set is linked to dispensing.
Okay. I have some idea, like even if you give a provision, if you're selling to a hospital, if you give a provision to add a new drug, the informations from a particular doctor, like some doctors are like whatever he said is right? So if you give a doctor, like if you take a neurologist, he will have only this set of 10 to 15 medications every time he usually prescribe. Like nutraceuticals also, there is a lot nowadays coming up. So that is also, you can make a separate thing. They can add a new drug, new information for that particular medication, so that there won't be any clashing between his counseling and our counseling, especially in a hospital. For their reputation, they definitely look for it, right?
Excuse me. I've been listening to all these questions. A very simple answer is that this all comes from an experience. When you become a pharmacy graduates and when you go into practice, and Sri Devi said very rightly that how much you want to say and what you want to do. We are not here to discuss how to improve the program or what we need to do. Professor Bijon Mishra gave the very important information and he can get together with Tilak. But at this point, I like to recognize one person. Without his information, I would have never met Tilak. Uh, I see his name here, Dr. Raj Vaidya. 2 years back, he introduced me and sent the contact number of Tilak. And that's the way I got connected with him. I have spent more than 2 hours with Tilak and about his software. In short, what I can say that this is a better program than what we have got in the United States.
Wow.
This is a program created by a professional pharmacist who has got a more than 10 years practical experience of a clinical pharmacy and how to practice in a community pharmacy. Not only that, there is always an input. There is a softer side of it because Sri Devi is involved in it. Because one pharmacist, male or a female, they cannot do everything. But when you unite them, it makes a better thing. And for that, I'm always grateful to Raj to pick up new people. Okay. And Raj generally doesn't like people thank him. If you all have looked at the president's message from the IPA Dr. R.N. Gupta for the month of March, and I talked to him, and he made a special note of Maddox Pharmacy. I request all of you to go on the Maddox Pharmacy website, look at it, and in September last year in Hyderabad, there was a conference. I forgot the name of that thing, but Raj Vaidya, Dr. Chandrasekhan from Ohio State, they displayed the function of Maddox Pharmacy. There were two students came from America. They both visited their pharmacy and they both agreed that what they have got information in this database is far superior than what we have done. Dr. Chandrasekhar has been talking about it in America. Now, when I talked to Tilak 2 years back, he was a very dashing, aggressive pharmacist. When I talk to him now, he's a he's a he has got a data. What he told me, he has got 11,000 customers. That commutes to the 3,000 household. He has got so many meds inside. He has got so many information. And when you talk about the demographic thing, what can happen in Hyderabad may not happen in Gujarat. Different habits, different things, and you can update it. And he is prepared to do this. Lastly, I like to say, because I know Dr. Somani has to do the vote of thanks. Everything costs money. The reason this program was created, so the academic people can generate a new breed of people who will be interested to start a community pharmacy, especially PharmD. Now, what I would feel comfortable, and I request you on the beginning of a new year, and I'm sure Dr. Joshi will do it. I know that Dr. Somani, he always likes to do new things, so he might also join. Start some kind of a model pharmacy program, charge students 500 rupees a year to join in, and if you have got 4 students who does this thing, the software cost will be paid for. I can tell you. Okay? You need 4 students every month, each one paying 500 rupees, so they can learn what to do. And eventually, when this software can be leased. But that's a separate issue. We will come back to that. And to understand the software, it takes around 1.5 hours to 2 hours. So, Tilak, I thank you. Dr. Somani, thank you for arranging this. Dr. Joshi has already left. But I really feel that he has put a lot of work behind this thing. And Dr. Bijon Mishra, I'm glad that both of you are in Hyderabad. When I come Hyderabad next time, I will I will definitely try to meet, because one of my high school buddy, he lives in Hyderabad.
Very good. Please do come and let me know from before, so that I
Yeah,
am
sure.
present in Hyderabad to receive you.
Yeah,
And it will
yeah.
be great to have you amongst us. I
Yeah.
just want to conclude by, my last remark. As I'm based in Hyderabad and I'm going to Delhi on the 2nd to meet up with the high officials of Government of India who are dealing with Jan Aushadhi, I would like to seek your permission that can I share this idea or this concept which you have already floated with them, and seek an appointment with them so that you can make a presentation to them. May I
Yeah,
do
we
that?
can work. Yeah, you can work on that, and Tilak will get back to you, because this is all in a.
Yeah, Tilak, I have already put my phone number and my email ID on the chat box.
Okay.
So just reach out to me. I will be very happy to connect. And
Sure.
I would definitely like, because as we all agree, today is New Year. Let's start a great kind of an initiative on this New Year day. So thank you, Dr. Madhav, for giving me this opportunity.
Thank you. And Zora, thank you so much. I think I talk more than 2 minutes, but I'm a Brahmin. So Brahmin always talks more, okay? So that's what happened. And Dr. Joshi should know more than that. That's the reason he left early. Raj, thank you for coming. And maybe we can do something with the IPA. Thank you so much.
Thank you.
I'm done here. Zora, I'm done. Okay.
Raj is there. I would like to hear from Raj.
He talks very little. He is a man of
No,
action.
I know that. I know him for many years now. 3 decades I know him. But Raj, your immediate reaction?
See, a lot of people talk a lot about best community pharmacy in India, and pharmacist is Raj Vaidya. But here is Tilak, who's going one step ahead. With the both of them and their professional inputs, they are actually doing what needs to be done on the ground. A lot of challenges, and it's a hats off to them that they're doing it. That is why we talk about them all the time, promote them all the time. So that's a great beginning, and it needs the boost from everybody.
Thank you.
Great.
Raj, when Tilak said about the breast feeding counseling, it reminded me what you and I talked about in 2001. I said,
Yes.
man, somewhere Raj has cloned somebody, and I said, it must be Sridevi that she put this thing into this, and those are the subtle points which will bring the customer back to you.
Yeah.
People tell me that there is an online pharmacy, there is a price control. No, there is a human factor which people need. And Maddox Pharmacy has got it. And when you guys go on their website, please click on the Facebook page and look at the things, what other informations are available. And please make a comment, and let's move the things. Thank you so much. I'm done. Raj, good to see you. Happy Ugadi.
Thank you. Same to you.
I think we are waiting for Dr. Somani.
Sir, he also is engaged with something. He has to leave early. So I think Zora only will be doing the vote of time.
Okay.
Yeah.
Thank you, Shilpa ji.
Yes, sir.
Thank you so much, Sridevi ma'am and Tilak sir, for your insightful and engaging session. I would also like to thank Mahadev Bhatt sir, Professor Bijon Mishra sir, and Raj Vaidya for their active participation in the session. As we approach to the conclusion of this enriching webinar, it's my pleasure to extend the vote of thanks on behalf of Dr. Rakesh Somani sir. On the behalf of the Association of Community Pharmacists of India, ACPI, and PharmaVision, I extend my heartfelt gratitude to everyone who contributed to making this webinar a success. First and foremost, I would like to express my sincere thanks to our esteemed speaker, Mr. Tilak Sairam Gajendran sir, for sharing his invaluable insights on redefining community pharmacy practice in India as per international standards. His expertise and deep understanding of modern pharmacy practices have truly enlightened us on how we can integrate global standards into community pharmacy in India. I would also like to extend my gratitude to our respected dignitaries, Dr. Anant Nayak Nagappa, sir, National President, ACPI. Thank you, sir. Dr. Mahadev Bhatt, sir, Mentor, ACPI. Thank you, sir. Dr. Rakesh Somani, sir, President, Western Regional Center of ACPI. Thank you, sir. Dr. Hanumantachar Joshi, sir, Principal Shada Vilas College of Pharmacy and President of ACPI. Sir, thank you, sir. I would also like to thank Sridevi ma'am, co-founder, and Tilak S. Gajendran sir, founder. I thank you for your valuable presence and support. A special thanks to all the organizers and technical team for ensuring the smooth execution of this webinar. Your hard work behind the scenes has made this event possible. Last but not the least, a huge thank you to all the participants for your active engagement. Your presence and enthusiasm show the importance of discussions like this in shaping the future of community pharmacy in India. With this, we officially we officially conclude today's session. A heartfelt thank you to all our esteemed speakers, dignitaries, and participants for making this webinar a success. We hope today's discussion has provided valuable perspectives on advancing community pharmacy in India. Wishing you all a wonderful day ahead. I thank everyone for their time. Thank you.
Zora, do me a favor. Send me the WhatsApp number for Dr. Bijon Kumar Mishra.
Yes,
Thank
sir.
you
I have
so
copied
much.
it.
Okay, namaskaram, everybody.
Thank you.
Thank you, sir.
Thank you.
Happy
Thank you,
God.
everyone, for
Yeah,
attending
everyone.
the presentation.
Thank you so much for taking time to listen to us.
Sridevi, you did good. Okay,
Thank you,
you
sir.
did good. I won't say thanks to Tilak because we have to get a lot of things done.
There you go,
Namaskaram.
sir.
Thank you, sir.
Thank you, sir. Thank you, Nagapal, sir. Rajvindra, sir. Thank you, Rajvindra, sir.
Yeah, welcome, welcome.
You'd come to our pharmacy, sir. You always
Yeah,
right.
yeah, missed it last time.
Uh,
Next time, definitely.
sure, sir. Sure, sir. I just need to. Change that. Thank you, Nagapal, sir.
Thank you very much.
Thank you, sir.
You
Thank
planned
you
on
for
very
attending
well.
the session.
Hmm?
Thank you, sir.
The recording you must be having, you please share it. Or
Right,
Zora,
sir.
you have it.
Yes,
Yeah,
sir. I
please
have the recording.
request. Yeah, please do share with us. Yeah.
Okay. Okay.
Okay, bye.
Bye, sir.
Bye, sir.
Have a
I'll
good
call
day.
you soon.
Yes,
I'll call you soon.
Sure, sir.
Hmm?
Sure, sir. Thank you, sir. Okay.
Welcome.
Okay.
Namaste.